Good morning, my name is Ruth. I'm going to be your nurse for today. I'm going to do an assessment on your chest. So we're going to do posterior and anterior. I'm going to start with posterior first, okay? So I'm just going to ask you to turn that way. Okay, so being that I wash my hands, down some gloves, I'm going to inspect the breathing, palpate the scapula, and palpate the spine to see that there's no abnormalities. I'm going to also palpate for any lesions or any tenderness. Okay, so Stephanie, now I'm just going to listen to your lung sounds, okay? Just take a deep breath. Deep breath. One more. Okay, so your lung sounds are clear. I don't hear any abnormal breath sounds. Your normal breath sounds, which are considered bronchial, bronchial-vesicular, and vesicular. Okay, Stephanie, so now I'm going to ask you to turn towards me. So now I'm going to inspect the anterior portion of your chest. I'm going to palpate your any tenderness, any abnormalities. There's no lesions. You're not using any accessory muscles, meaning you're not short of breath. You're breathing normally. I'm going to listen to your lung sounds. Take a deep breath. Okay. Okay, so like the posterior portion, everything sounds normal, no abnormal sounds. I'm gonna palpate your sternum and make sure it's in the midline and that it's straight. There's no tenderness. Okay, your breathing, I'm observing your quality. Make sure you're at a regular rate. No abnormalities found. Assessment of your heart and your arteries. So I'm gonna ask you to look up. I'm gonna palpate your carotid artery one individually. Check for elasticity. Make sure there is no tenderness or any bulging. I'm gonna go ahead and listen to your arteries individually using the bell of my stethoscope. Okay. So at this point, you would be laying down. Patient would be laying down with head extended up. Okay. So I'm just gonna ask you to hold your breath. Okay. You can take a breath. Okay. Now hold your breath one more time. Okay. So everything sounds normal. There's no brewing, which we don't want to hear. Now I'm just gonna ask you to look to your left. I'm gonna check the jugular vein. I see pulsation, that's normal. There's no overextension. Okay, that's good. Everything is elastic, normal, no abnormalities. Okay. So now I'm gonna take a listen to your heart sounds. You can just breathe normally, okay? So I'm gonna start at your aortic. I'm gonna move to your pulmonic. So I'm gonna go to your herbs point. Tricuspid. And then your mitral. Okay. So I hear S1, S2, which are normal heart sounds. I hear no murmurs, no bruits, or anything abnormal. Now I'm gonna do an abdominal assessment. So I'm gonna inspect, make sure if there's any lesions, any striae, which we discussed that due to pregnancy there's striae. Observing your abdomen matches the color of your skin. Okay, so now I'm going to go ahead and auscultate your bowel sounds, okay? So I'm going to start in the right lower, move to the right upper, the left upper, and the left lower. So you have positive bowel sounds in each quadrant. That's good and that's expected. Now I'm going to percussing. Okay, and then I'm going to do light palpations, noting if there's any tenderness. Do you have any pain? No? Okay. Then I'm going to do deeper palpations. Still no tenderness noted, nothing abnormal. I'm going to palpate around the umbilicus, making sure that there is no bulging that can indicate a hernia or anything. No tenderness. So your abdominal assessment is normal. No abnormal findings. I didn't find any hernias. Your bowel sounds are positive, so everything looks fine.